fairly new nonprofit. We've only been around since 2010, so I thought I would spend a little bit of time chatting with you about how we got started. Sleepyhead Beds, our sole mission is to put Kansas City kids in beds. So kids that don't have them, we provide beds for them. The whole idea got started by this woman, Monica Starr, who was working as a CASA advocate in the late 2009 time period. And she discovered that some of the kids that she was working with and advocating for could not be reunited with their families because they didn't have a bed. That's a really low barrier, she thought. You know, a twin mattress, a box spring, and a mattress. And she was really astonished by that. And so she decided she was going to see if she could fix it. And she tapped her network and started going out and collecting beds from all of her friends and family. And it morphed from there. She started having an impact and she felt good about that. And as she had impact, the word spread about what she was doing and people started calling her and making donations. Over time, she discovered that 1 in 42 people here in Kansas City, kids specifically, do not have a place to sleep. They're sleeping on the floor, they're co-sleeping with parents and other siblings, they're sleeping on the sofa. They don't have a bed of their own. This, as you might imagine, creates some issues for kids. And I've asked one of our board members, Dr. Kevin Smith, who's a pediatric psychologist at Children's Mercy Hospital, to tell you a little bit about the impact of not having a bed and what that means to kids.
Well, thank you for having us tonight. I feel really fortunate to be involved in Sleepyhead Beds, but also to have the position I have at Children's Mercy in the Sleep Disorder Center. Because if you want to impact the life of a child, you improve their sleep. And in fact, I don't know of any area that really isn't touched by sleep, and there's a plethora of research that supports this. Sleep affects mental health, specifically depression and anxiety and ADHD, and in fact, I see a lot of kids with ADHD in our sleep clinic that is either exacerbated by poor sleep or misdiagnosed, because poor sleep can think about how you are when you have a rough night of sleep, how focused you are the next day. Sleep affects interpersonal relationships, both with peers and at home. Sleep can also affect physical aspects of a child's life as well. In fact, there's some relatively recent research to look at the relationship between sleep and obesity. We all know the impact of obesity on our society, and especially our children. And then look at the parents of children who aren't sleeping well. Parents who have kids with sleeping issues tend to have to get up 2 to 3 times more than parents who don't, and they lose about 30 to 40 minutes of sleep per night. That doesn't sound like a lot after one night, but over and over and over again, there's a cumulative effect. And that's just the average. Trust me, I see easily the sleepiest parents in Kansas City. But just on a personal level, I got involved because when I moved here 6 years ago, a lot of my patients didn't have beds, and I don't care how many empirically supported treatments I use or my physician colleagues in helping kids with apnea and periodic limb movement disorder. If you don't have a bed, it's really hard to get anyone moving forward. I was talking to my mom a couple of weeks ago, and she asked me about my job and my involvement with Sleepyhead Beds, and we were just looking back, and we had some lean times in my family, but I always had a bed. And just the families that come in after we get them a bed, that's just an awesome feeling. So I'm really, really happy to be here tonight and appreciate your time.
Monica turned the organization over to professional management in 2013. She and her family were moving, and they now live in Dallas, Texas. And since that time, it's been run by Sam Cook, our executive director. Sam left in August and took another job, and so I'm currently serving as the interim executive director. But Sleepyhead Beds, since its inception, has put over 7,500 kids in beds. A real great byproduct of what we do is that we also keep stuff out of landfills. So we take gently used mattresses, we sterilize them, and we recycle them. In addition to placing 7,500 kids in beds, we have kept 350 tons out of landfills. This is our warehouse currently. It's a 2028 prospect. It's about 2,000 square feet, and what we do really is not rocket science. We basically collect beds, and when we get the warehouse filled up, we have a distribution day. We also collect bedding, new and used, as well as pillows. Pillows cannot be recycled, and so we collected brand new pillows. We do a lot of this by ourselves using the Sprinter van that we got through a Mark grant in 2013. And we have driver Michael who goes out 5 days a week and picks up mattresses. We charge a small $30 fee for people, and we will come and get your mattresses. Michael's been trained to recognize what is good and what is not, and we typically bring them back and separate them into 2 piles. One goes to Avenue of Life to be recycled, and the others are ones that we can sterilize and recycle back out into the community. We do it all with a variety of volunteers. We sometimes do large distributions and large pickups. We've picked up beds from Kansas University, from a variety of hotels, from the University of Missouri, Kansas City, and we're currently working with Fort Leonard Wood. So we're tapping into the community and starting to get a name for ourselves and become a source for beds. This is one of our distribution days. Every 2 to 3 weeks, we open up the warehouse. We send out an email indicating that we have beds available. People enter our system through either the social services network or the ministry or schools, or they can self-refer. The ones coming through the system are priority clients, but they're all invited to show up to pick up a bed on the days that we have them. We distribute starting at 9 a.m. The line usually starts forming at 7:30 a.m. We give out all the beds in typically 1.5 to 2 hours. This is a group of volunteers post-delivery. You can see in the background that we have no beds. This is what our warehouse space looks like post-delivery as well. We're a small organization right now. Our annual budget is $120,000. We have 2 full-time staff people and 1 part-time staff person. We are working diligently to try to address this problem. Like Kevin, I've been involved with the organization since 2013, and I keep thinking as I show up to these things that we're going to eradicate the problem, that it's going to get better. But the reality is we have over 1,500 families right now, many with multiple kids on our waiting list, and the list keeps growing. So it's a continual problem here in Kansas City. We have the system worked out. What we need now is money to help us with capacity issues so that we can pick up more beds throughout the week, do it in a more efficient manner, and get out and talk to people so that they can understand what they need to do to help us. We're working with the community to create bedding drives and pillow drives, and so it takes our staff time to be able to do that. So the grant that we're asking for, the $15,000, is a significant increase to our annual budget and would allow us to ramp our capacity significantly. Thank you.
Is it all twin beds that are donated, or is it a variety?
No, good question. We love twin beds. They're actually the hardest to get. Box springs and mattresses are what we want. We also take full beds and queen. We do not take king. A lot of families who come to us will put 2 kids in a queen bed or in a full bed if they're small. And a lot of times we run out of twins. That's the first thing that we run out of.
Do you take frames too, or just the
No, we just take the box springs and the mattresses. We're the only ones in town right now doing this, and you can get the other. You can get bedroom furniture and the frames. A lot of other places, it's really hard to get a mattress set, a clean one that's been cleaned. Yes.
As far as the requirement, there be a bed for a child to be returned from foster
Yeah.
care to their parents. Does that have to have a box spring and a mattress, and just be a mattress?
No, it has to be a box spring and a mattress. And we have those, but we also give out just mattresses as well. And typically we service not only the kids, but the kids and their family. Many times it's a familial issue to not have enough beds.
Thank you very much for your time.
Thank you very much.